Magandang gabi po! Welcome to the pilot episode of Usapang Fil Am, the new interview format talk show of PinoyLife Media. Ako po si Noel Pangilinan. I teach Filipino language and Philippine history at the College of Mount St. Vincent in the Bronx, and I am a senior editor at the Asian American Writers Workshop in New York City.
Kumusta po? I'm Cris Godinez, an immigrant rights advocate actively practicing U.S. immigration law to help families come together, help businesses grow, and protect at-risk migrants. Noel?
Tonight's show of Usapang Fil Am is sponsored by GMA, Pinoy TV, the New York State Nurses Association, or NYSNA, the Philippine Daily Mirror, Design District Studio, the Law Office of Cristina Godinez, Lead Consulting, and Kababayan Media.
Tonight, we celebrate the unsung heroes of the U.S. healthcare system, our nurses. We are pleased to have a candid conversation with two Filipino American nurses who will talk to us about what it was like for them when COVID-19 struck. What was the pandemic like for them? How are they now that the worst seems to be, hopefully, behind us? Kumustahin po natin ang ating mga nurse. Let's bring in our first guest, Zenei Cortez. Noel?
Salamat, Cris. Zenei Cortez is the president of National Nurses United, the biggest nurses union in the United States. A 40-year veteran of the healthcare profession, Zenei has been the president of NNU since 2007. Magandang gabi, Zenei.
Good evening. Magandang gabi po sa inyong lahat. I'm very happy and very pleased to be here. And hopefully we will have a good conversation tonight about what's happening with our nurses all over the country.
Okay. First of all, on behalf of Usapang Fil Am and PinoyLife, I would like to thank you and the entire nursing community. Maraming salamat for all that you have done and are doing in this critical time of the coronavirus epidemic. Saludo kami sa inyo at sa lahat ng nurses, or as we say in Filipino, sa inyong mga nurse. Zenei, my first question is, you immigrated to the U.S. when you were 17 years old. What made you want to become a nurse?
Okay, so umpisa tayo. I left the Philippines at a young age of 17, a year after high school. And when I came here in the U.S., it seemed like everybody is and was a nurse. Starting from my father's sisters, my older cousins, and then eventually my sisters, and then me, and then now nieces, grandnieces, they're all nurses with cousins, male and female. So I grew up in a family of nurses, and what really made me want the profession or like the profession is the fact that even if you don't practice nursing, you can apply and use your profession to take care of your family, your elders. And so I thought it's a good vocation and a good profession to follow.
But growing up, although you grew up in a family of nurses, did you think that you will be a leader of a nurses union?
Well, that was medyo malayo sa pag-iisip ko, no, when I first became nurse. I started my career in Chicago, and at a young age after graduation, you just go to work, go home, party, go home, work. And then I moved here in California, where I realized that there is a nurses union, but then back in those days, they were not really doing anything for the nurses, the staff nurses. And then I can see that my colleagues will be complaining about different things like staffing, not being granted vacation, not being granted the time off for educational leave. And then I said, why do you guys, why don't you do something? So I started looking into it. And then what really energized me and what really pushed me to be very involved in the union was the fact that in 1990, I applied for a position, but I was bypassed for the position because the manager said she will not be hiring any more Filipinos because she had a lot of Filipinos in her department. But I said, that's not right. I meet the qualifications. I'm very qualified to do the job. And so I fought it. So with the help of my union, the California Nurses Association, we fought, to the max. And eventually I got the job. And it resulted to the manager being fired for being a racist, sorry to say, and that just that comment in itself was not acceptable to the company. So that's what happened. And then it energized me to become a leader because I was thinking, here I am, I'm very outspoken. And then it happened to me. Paano na yung mga tahimik na hindi magsasalita or hindi magko-complain, or they'll just take it, So I said, something needs to be done. And so I went for the leadership.
So that is the gain for the National Nurses United. Okay, so it's a bit more than a year since the pandemic. What would you say were the biggest challenges that the nurses here in the United States faced in the past year or so?
So it was really heartbreaking, at the beginning of the pandemic because we didn't have the adequate personal protective equipment that we needed in order to take care of our patients safely. When we started wearing masks, it was not even the N95 masks. We were told to take it off because it was gonna scare our patients. But we needed that protection, that least amount of protection. But they were not providing it to us. So management says, well, if you want to wear a mask, just use your bandanas or use handkerchiefs as a mask. That's what we were told. So it was really, heartbreaking. Again, I'm still disappointed to this point. Here we are being told to fight the virus, but we were not protected. They will not send in a firefighter into a burning building without the adequate equipment. So why are they doing it to the nurses? Is it because we are a women-dominated profession? Or is it because majority of us really do not complain and just, take it the way it is? And so a lot of our nurses passed away because of contracting the virus. And then we thought that would be the turning point where they will provide us the equipment. So they acquired the equipment, but they put it under lock and key. So if we needed a mask, a gown, or anything to go into a COVID positive patient's room, we have to look for the supervisor. So in cases of emergency, when we need to rush into a patient's room, we risk our lives because we want to save the life of the patient, and yet, we needed the PPE in order to go into that patient's room. And so, day in, day out, that was how it was. And then lots of patients are very, very sick. There were no family members who are allowed to visit and stay with the patient, to the point that we would just hold the patient's hand, at the end of their lives. So it was really not just physically taxing, but we were emotionally overburdened as well because of what was happening. So it was really a big challenge, and I really admire the resilience of the nurses, especially Pinoy nurses, because they did not want to leave the patient's bedside. And so they all stayed, as much as they could to be with the dying patients. So that's what it was at the beginning of the pandemic, when we were losing patients left and right. And at the same token, a lot of our nurses and other healthcare workers were dying.
I don't think I can understand how it feels to have many patients, co-workers, friends dying before your eyes. So, was there a time that you felt like, what's happening, that this seems to be a lost cause?
Well, once in a while it would come to you, but then if you start thinking about it, why did I really come, and why did I go into this profession? It's to help people. It's to care for the sick, the dying, the underserved. If we all feel the same way, there will be nobody left, to care for the patients. And then not only that, we also, back in our minds, because we did not have the PPE at work, are we bringing home anything to our families? And a lot of us live in a multi-generational household. Nandun ang lola, andun ang nanay, andun ang tatay. It was really difficult. And we fought hard, really, really hard, to make sure that the hospital provided us our scrubs that we can take off at the end of the shift, that they provided us a place to shower if we wanted to before going home. So those were the kinds of things that we fought for, not only for the PPE, but other provisions as well.
So these were not given to you by the hospital. You have to fight for them, right? So
Yes.
anyway,
yes.
yeah. Earlier you mentioned that well, actually, this is the National Nurses United, who said that while Filipino nurses make up only 4% of nurses in the U.S., they comprise 31% of COVID deaths among registered nurses in 2020. Why was this?
I think it's we did have a lot of nurses. You said why was there a lot of nurses, Filipino nurses, dying, right?
Yeah.
What happens is that a lot of the Pinays, our colleagues, we work in areas where COVID patients were being cared for. They were in the ICUs, whether it's critical care unit, medical intensive care unit, or cardiac intensive care unit. Mm-hmm. The Filipino American nurses are there. And then in the step-down unit, and myself in the post-anesthesia care unit, these are the critical areas, and a lot of our kababayans work in those areas. And so we were the hardest hit. And the other thing too is that a lot of our colleagues, Filipino colleagues, stayed long hours, doing a lot of overtime because we needed a lot of nurses. And for us, we treat our patients like they're our families. And so it's in our conscience if we do not stay knowing that there will be no nurses there, we end up staying because we had to make sure that there were nurses for the patients. But then it took a toll on a lot of our kababayans.
Right. We actually have some comments from viewers and participants. Mabel from Anaheim, California, would like to ask
If there are new figures on COVID-19 related deaths among Filipino Americans. And she comments, mas marami pang nagkaka-COVID na Filipino RNs dahil karamihan ng nurses dito sa US ay Filipino.
Mm-hmm.
She just wants that clarification.
Okay, so the way we tracked the number of nurses dying is our research department would go through obituaries, would go to publications, because the hospitals were not really mandated to report COVID deaths of nurses and healthcare workers. And so what we found out is that there were over 400 nurses to date that have died of COVID. And out of those 400, we were only able to determine the ethnicity of 370 of them. So we kind of looked, if the picture was there, we sort of like looked and see, do they look like they're Filipino or Asian or something? And then we went by the last name to see if they are Filipino. So it was like more of a guess, more of guessing. And out of the 400, 88 of them were Filipinos, and 44 of which were from here in California. And we know this is an undercount, like I said, because the hospitals were not required to report deaths of nurses and healthcare workers.
I think a hot issue right now is the CDC policy about the wearing or not wearing of face mask. So where does the NNU stand on this issue?
Well, we have been asking the CDC to revoke their decision because we are still in the middle of this pandemic. And so removing the mask guidance in one of our precautionary measures will only add up to more COVID cases. Of course, they said that if you're fully vaccinated, you can do that. But how can we tell who has been fully vaccinated from someone who has gotten the first vaccine or from someone who has not been vaccinated at all? There's no mechanism to police that measure. And so we have been asking them to please, change their stance on the masks because we still need it. The reason why our numbers went down a little bit, maybe from perhaps not as high as last year or a few months ago, it's because we've been following all the measures that are in place. And so if we take one of those, we're really afraid that our numbers will spike up.
May I ask if the nurses are still putting on the PPEs whenever they work?
Yeah, we do wear the PPE when we go into COVID positive patients. But we are still wearing our masks, our N95 masks at work. And we still use head cover if we work in the COVID-19 units, and gowns if we need to. But we're still using it.
In other words, your protocol is still the same now, even if CDC guidelines say you can take your mask off.
Right, because I think the hospital is exempt from their new guidance.
Okay, let's talk about Medicare for All. Medicare for All Act of 2021 was introduced in the U.S. Congress. Why is the NMU throwing its support behind Medicare for All?
So for the past over 10 years, we've been fighting for a single-payer healthcare system, which is the Medicare for All model. It's because we know that healthcare is a human right. It's not a privilege. And it was really made apparent in this COVID-19 pandemic that if you are not with any healthcare coverage, then you're in really pretty bad shape. So it made it more apparent that we need a single payer system of healthcare. And so Medicare for All will do that. It's everybody in, nobody out. Regardless of your ethnicity, regardless of your ability to pay, we need to have a single standard of healthcare, and that is the Medicare for All model. Right now, what I see, patients come to the hospital because they are very, very sick, because their current healthcare coverage maybe perhaps did not cover preventative care, or they simply do not have healthcare at all. So a lot of the conditions that they are in now could have been prevented if they have sought medical care in the very beginning or at the onset of their symptoms. And so Medicare for All will take care of that. They will have easy access to healthcare. They do not have to worry about coming up with a copay or any other monthly premiums. And I'll give you an example. I had a patient who was almost ready to go to surgery for removal of a gallbladder. So I've already prepared her, ready to go. And then the admitting clerk came and said, "I'm sorry, ma'am, you have to pay your $2,000 copay before you proceed to surgery."
Oh, wow.
My patient did not have $2,000. So she got up and left, but she needed that surgery. You know, so it's really, again, heartbreaking that our patients and the public would have to go through this. And so Medicare for All would be the solution. That's why we're fighting for it. And then again, with what happened in this pandemic, a lot of us have healthcare associated with our employment. So when a lot of people got laid off, a lot of them lost their medical benefits, their healthcare. And so Medicare for All will take care of that. It doesn't matter where you are, you can take your healthcare wherever you want to go. You cannot be forced to be tied to a job. So we'll keep pushing.
Yeah, Medicare for All will also help you do your work well as nurses.
Yeah, it will be, because we do not have to worry about, you know, our patients not being able to get the care they need because of inability to pay.
Maraming salamat, Zenei. This has been a very informative discussion. Thank you for sharing with us this situation of our nurses, and also for letting us know that Medicare for All is something that benefits all of us. Before we let you go, I have one last question. What image of nurses, especially our Filipino American nurses, do you want our viewers to think of and remember?
I want us and our Filipino colleagues and all nurses to be remembered as somebody who's caring and compassionate, and we will be there for you no matter who you are, no matter where you are. And it doesn't matter whether you're black, brown, yellow, indigenous, or your status in life, but we will take care of you and we will be there if you need help. We'll be there.
Maraming salamat, Zenei. More power to our nurses, more power to NNU, and more power to you. And hopefully, we can have you again in our future episodes.
Thank you. Thank you for having me.
Thank you, Zenei. Zenei Cortez, co-president of the National Nurses United, the largest nurses union in the United States.
And now, a word from our sponsor.
This year, we continue the legacy of providing the very best in Filipino entertainment.
So it's true, gusto mo nga ako.
Isa lang ako sa mga fans.
Bago ma-fall sa isa't isa.
The feeling's mutual. Babawiin ko ang lahat. I just really want the best for us. I'll never let you go. Grabe naman tong Scorpio na to. Umamatay ako. Ipaligidin kita.
With many more shows coming soon. From drama, romance, reality, and fantasy. For world-class programming, keep it here on GMA Pinoy TV.
Tonight's episode of Usapang Fil Am was made possible by our sponsors, GMA Pinoy TV, the New York State Nurses Association, the Philippine Daily Mirror, Design District Studio, the Law Office of Cristina Godinez, Kababayan Media, and Lead Consulting.
At this point, we would like to plug in the coming episode of Talk of the Town on June 17th. In this episode, June po sa amin, we will be talking about Independence Day, which is celebrated on
June 12, results travel in the U.S., recent immigration developments affecting Filipino Americans, and mental health concerns within our community. This will be live streamed on Facebook Live. Noel?
We also would like to remind you to go out there and show your Pinoy pride. Join the Philippine Independence Day Parade on June 6 in Manhattan. The event will be live streamed starting at 11:45 a.m. on PIDCI's Facebook page, PIDCI official/live.
Wow, the guests there, Florante, Mondavid, and Easy Mill.
Wow, that's a star-studded. And we have some news flash for you. Cris?
Oh, yes. The latest on the safe staffing bill in New York. Our friends at the New York State Nurses Association have been working hard on this. New York lawmakers approved a pair of bills creating safe staffing standards for hospitals and nursing homes in New York. These bills are now waiting for Governor Andrew Cuomo's signature. One bill requires hospitals to create clinical staffing committees, which should include not just the hospital administrators, but also the frontliners like the nurses. So these staffing committees will come up with safe staffing plans. The other bill is about nursing homes, requiring a standard of 3.5 hours of care per patient per day at nursing homes, and the nursing homes will also be required to publicly disclose information about their nurse staffing. So this is not just for addressing the understaffing issues in New York State, but it's also for helping protect the welfare of patients. So we're just waiting for Governor Cuomo to sign this bill. Noel?
to tell us how it is or how it was to be a nurse on the ground during the onset and the height of the pandemic in New York City. Cris?
Fatima Cabillon, RN. Fatima is a registered nurse at the step-down ICU unit at New York Community Hospital in Brooklyn. At around this time last year, we all know that New York was at the epicenter of the worst pandemic of the century. In mid-April 2020, up to 800 New Yorkers were dying of COVID-19 every day. Fatima was in the front lines at this time, along with her mother, Maria Gia Cabillon, the head ER nurse at Kings County Hospital in Brooklyn. Fatima is here to tell us what the past year was like for her and her family. How are you, Fatima? Kumusta?
Hello po sa lahat. Welcome po. And thank you for having me.
First things first, maraming salamat. Thank you for all the work that you have done.
You're welcome po. I'm all as a nurse, we're always here for everybody.
Yes, the work that you do for all of the weakest, the poor, those who are sick, those who are injured, especially during the pandemic, it's invaluable. We cannot say thank you enough. So, you also come from a family of nurses like Zenei Cortez. It looks like you were telling me before, puro mga healthcare workers kayo. Tell me about your family. How did you go into healthcare, the healthcare field?
My mom used to tell me that when she was in high school, she wanted to be a doctor after high school, magdo-doctor sana siya. But then they couldn't afford education back then. So her aunt said, "Why don't you take up nursing?" So her aunt sent her to school, and then everybody took nursing. Her sister, and then all of us na din po, including my sisters. We are all nurses. If you're not nurses, doctors or physical therapists.
Wow. So
just like me, Zenei.
It's a family business, no?
Yes.
So, Fatima, May 9 was Mother's Day.
Yes.
And it must have been a different Mother's Day for you. Can you tell me about it?
Yeah, since last year, it has been different because my mom passed away April 26th of last year. So every May 9th, usually my mom would maglalambing po yun, oh, pwede pa bili wallet, pwede pa bili ng ganito, ganyan. But she's never like that before. Ngayon lang siyang before, like years before she died, ganun siya. So, it's hard, but you know, you have to move on. Life must go on. I-remember na lang po namin siya of all the good things that she's done. Not only for us, but for other people as well.
Yeah, for our viewers, Maria Gia Cabillon, the mother of Fatima, was the head ER nurse at the Kings County Hospital in Brooklyn. She's known there as Mommy G, right?
Mama Gia po.
Mama G. So tell me about her work there at Kings County Hospital, how it was like for them there. Can you share us a little bit of your mom's background as the head ER nurse at the hospital in Brooklyn?
My mom has been the head nurse for I'm not sure how many years na, but she's been working there almost all her life at the emergency room. So when the first time I came to the United States, she brought me to work with her. She also worked night shift. So it's very chaotic in Kings County. It's a trauma center. So everything happens in Kings County. So these and the picture show now, these are her children. So she takes very good care of them. She's very, very protective of her staff and also her patients. She will always make sure that her patients get comfortable in the emergency room because the Kings County is always packed with patients.
But unfortunately, your mom was one of the early casualties of COVID-19.
Yes, she is.
And you told me once that you were also sick around that time. Tell me what it was like for you at around April 2020. What was it like for the Cabillon mother and daughter team at the time?
So my mom one day she came home with an IV line with a hep lock on her arm, on her hand, And then I told her what's going on. And then she told me that she was just dehydrated. She never admitted that she had COVID already. She never told us until she died. Never. She never mentioned that she was COVID positive. And then she was admitted to the hospital. And then 3 days later, I was positive too with COVID. So it was hard because I was isolated. We cannot visit her. She cannot talk. She can only text us, but that from time to time lang because she was on a BiPAP and she was really struggling to breathe. So it was very very hard, especially also for my sister who is taking care of me, and then at the same time doing what my mom is asking her, like to bring food or something like that for her.
So was
if
your
if
mom in
me
the
and my mom,
hospital?
yes po, she was in the hospital 3 days after she was not feeling well. She was admitted because she was never sick. Only COVID. That's the only time that she got sick.
Wow. So she caught it at work, you think? I mean,
Yes.
because
Yes po.
okay. So was there any other, would you know if there was any other in her team who also caught COVID-19?
Everybody, I believe. When I talked to her, when I spoke to her coworkers in Kings County, everybody said that they all had COVID. They all got it. Everybody was also sick from COVID.
So around that time, was it a similar situation in Brooklyn hospitals where wearing a mask was not encouraged, or the PPEs were not available to nurses who were facing patients? Can you tell us about the protocols in place at that time?
When COVID was just a rumor, nung hindi pa siya ganun, yung hindi pa hindi pa peak ng COVID, we were already given N95. So siguro they were like trying to ready us, to prepare us sa start ng COVID. But the PPEs po, they were telling us, oh, we don't have it anymore. So we told our supervisors that if you don't give us PPEs, then we'll not admit patients. We'll just leave them down in the ER because the ER was already packed and they need to send patients up to us. And the supervisor said that, okay, I'll try and look if meron pa. So sabi namin, until the PPE comes, we'll not admit patients because we don't really know what to do. Do we put it on us and take it off outside, or take it off inside the room, or wala pong ganon? And our PPEs were not as good as our PPEs now. Parang ano lang siya, parang plastic lang siya that you put over your head and then that's it. We don't even have shields before.
Okay. So, yung mga patients nyo noon, sinabi mo na hindi nyo iaakyat sa ibang unit. So, nakatambak sila dun sa ER. But then again, that's where your mom was really working, with her colleagues. So, yun yung parang pinaka-epicenter ng COVID. Right.
So she has two hospitals, right? So, Kings County and New York Community. So, both hospitals are like very chaotic at that time.
Okay, what could the hospital administration have done? I mean, what could have been done better for you as nurses to respond to this situation? I mean, was there something they could have done to prevent this from escalating?
Yes po. I think they should have given us our PPEs first. Yun ang pinaka-importante for us is our gears, because we cannot cater to these patients if we don't protect ourselves first. So if we are not protected, how are we going to give our 100% to our patients? So siguro the supervisors then didn't really know what was going on at that time, because COVID just came in just like that.
Right, but you said that you also caught COVID. Tell me what happened when you caught COVID at that time. I mean, what were your symptoms? Were you asymptomatic? Did you lose your taste and smell? What was it like?
Miss Cris, I'm just lucky because I only had cough for 3 days. That's it. And my aunt was telling me, maybe you have COVID. I said no, maybe it's just parang napagod lang siguro ako. That's what I told her. And then I got tested. And then yun na, nag-positive. Na-cough lang po talaga siya for the first time. For 3 days, and then nawala na siya after that.
Okay, just a question. Actually, we have a comment from Jerry from Maspet. He says that my wife, his wife is a nurse, and to avoid being close to him and his children, when she comes home from work, she has to distance herself from them. So it's like social distancing from people in the household. So when you had that COVID, do you have to sequester yourself away from the other people in your house?
Yes po, I have to isolate myself with my from my sister. My sister, she took care of everything. She bought me those plates, paper plates, everything disposable. And then every morning she would ask me, "What are you gonna eat? Are you ready for your coffee?" She would do all those things because I cannot go to the kitchen. I'm only nalipat po ako sa couch. So dun lang po talaga ako sa couch. And that small couch, I have to stay there. I cannot go near her. When she gives me my food, she has to wear the mask, she has to wear the gloves. Meron din po akong bleach spray that when I go to the bathroom, I have to spray every single thing that I touch. So I have to be really isolated from her.
So Fatima, sabi mo most of your family members are also healthcare workers here in the States, right? Are they
Apa.
were they exposed in any way to COVID-19? Did any of them also
Yes
catch
po.
the disease?
Mhm. Yes po. I have a cousin who works in transfusion center in Sloan. He also had COVID. He was also admitted to to the hospital. He was also there for like a week then. So most of us, most of us in the family, we had COVID.
Because of exposure to
Yes. Mm-hmm.
it's work related.
Yes.
So how have you been since you got the infection of COVID? I mean, have you been do you have the antibodies already? Were you vaccinated?
Yes, I'm fully vaccinated now. I'm not sure about my antibodies yet. I have not checked it. Pero from time to time, I'm struggling to breathe. Especially pag yung mask ko is just on me for like 12 hours straight. I'm really struggling to breathe sometimes. And when I went to I think I had my CT scan last year. My left lower lobe of my lungs were may scarring na po from COVID.
Wow.
Mm-hmm.
So
So
that
I'm not
means
sure if it's gone now.
that means meron pa ring lingering effect yung COVID-19 infection mo.
Yes po.
Well, is this not an issue for occupational safety or, something that needs to be addressed on a larger national level, that nurses need to be compensated and protected after
Yes.
they've been exposed? I mean, pretty much
Yes.
like what happened to first responders in 9/11, right?
Mm-hmm. Yes, I agree. I think we need to be compensated with what we had, because I have coworkers that their lungs were collapsed. It took them 5 months to recover. Some of my coworkers nagka-develop po ng heart problem. May mga enlargement sila sa heart na they don't know where it came from. Mga ganun po.
Wow. So work must be tough at the hospitals during the pandemic, but now we're more or less seeing a tapering off of cases. What's it like right now in your work situation? Do you still deal with understaffing, more patients coming in? What's it like?
Yes, we will always, I think the understaffing will always be there. I think hindi na po mawawala yun sa hospital setting. But and I'm happy that there's a bill that's about to be signed. And ngayon po sa work, it's better. We were able to manage things there. We have enough and sufficient na PPEs for everybody. That because ngayon we are required to, when we put on a gown, when we get out of the room, we have to take it off and then get a new one. So it's not like before that you have to put it on you and then you have to reuse it the next day.
Oh, you mean before when COVID was at
Before
its
the
height,
pandemic,
you were reusing it?
Yes, we had to reuse our jumpsuits, our face shields. We have to reuse everything. Minsan po butas-butas na yung PPE ko.
Oh my. So you clean it, of course. When you reuse it, you have to,
Yes.
disinfect the whole thing.
We
So
have to
that's
wipe
added
it
work
up
for you.
inside and out. Mm-hmm.
So that's just, that's just so.
Okay, just a
Um,
question for uh okay, the question is how do you stand with the recent policy regarding the not wearing of face masks?
I'm against it po. I'm fully vaccinated. I've seen it all, but I'm not comfortable taking my mask off. I'm not comfortable. Um, I get paranoid, especially when I go out of the house. I still get paranoid if I don't wear a mask. So I think CDC should really. I agree with Ms. Zenny. I think CDC should change that. I think they should stop saying that it's okay not to wear a mask. My entire family, we are fully vaccinated, but when we get together, we still wear a mask. Sorry, Miss Chris, I didn't hear you.
Here's a comment from Gina, who works as an ICU nurse in Chicago. She said, it's difficult to put on PPE during the workday. I drink less to avoid bathroom breaks.
Yes po.
Isn't that unhealthy, Fatima? I mean, I'm just, from my pedestrian standpoint, I mean, that's not.
It's hard. It's really, really hard to use the bathroom. First you have to clean your bathroom, and then you have to take off everything. So it's either you don't drink water, or you need to choose. Kasi nakakapagod talaga. You have to tie, you have to zip up, you have to put it on, and then after, when you need to go to the bathroom, you have to open na naman. Tapos tatanggalin mo na naman.
And your work hours range from how many? 8 hours? 12 hours?
12 hours and a half.
12 hours and a half. That you try not to hydrate yourself because it's too much of a trouble to
But
put on the
sometimes,
PPE.
but sometimes you really can't help it. I'm always, always thirsty at work, and I'm always, always hungry because it's so hot. You're always sweaty.
Yeah, tsaka lagi kayong nakatayo, di ba?
Mm-mm.
And I
Because you have
think
to watch
mahirap
your
huminga. Di ba mahirap huminga pag
Mahirap po, sobrang hirap po huminga sa N95. Yung doon lang naka-cover sa face mong ganyan, yun lang you're breathing there, the same air, in and out, in and out.
So isn't there a health hazard for nurses also with all the wearing of PPE for 12 hours straight?
Yes po. Mm-hmm. It is, because you're always sweaty, especially yung sa likod talaga.
Wow. So yeah, the sacrifices you make are just, astounding as far as, people like us are concerned. We just can't thank you enough for the work that you're doing under these conditions. So any parting shot from you, Fatima? Any message you want to send across to our viewers, to fellow nurses?
I just want to say that let's just keep fighting. Let's not lose hope, because I know that this will be over one day. And we should always remember that our patients need us more than we need them. So they really need us. That's why they're there. And always think about why you became a nurse. Always think about that. So
thank you so much, Fatima, for your story and sharing the experiences you have as a nurse, and your mom's life story as a nurse, and contributing to the wellness of her patients. So
thank you for having
me. So we hope nurses will no longer be the unsung heroes. Hindi naman dapat natin kalimutan, or we should be able to thank them in better ways than just front lawn signs that say we thank our nurses and frontliners. There should be something a little more substantial, I suppose. Worker protections, occupational safety, better compensation, safe staffing, not just for nurses, but also for patients. So we hope nurses will no longer be the unsung heroes. They should be celebrated as our superheroes. So thank you for joining us on this pilot episode of Usapang Fil Am. Noel?
Send us your comments, questions, and suggestions for future episodes. You can send it on our FB page of PinoyLife.net, or you can subscribe to our YouTube page. So, yeah, hope to see you in our future episodes of Usapang Fil Am.
Special thanks to GMA Pinoy TV, New York State Nurses Association, Chito Quijano of National Nurses United, Julia Camagong of New York State Nurses Association, to all our nurses fighting the good fight for all of us against the pandemic. Saludo po kami. Big shout out na pala to Marikit Pangilinan who's celebrating her birthday today. Happy birthday, Kit! Kita-kita po tayo uli next time sa June 17 po. Take some time off and join us in Talk of the Town. June 17, same time, 8 o'clock.
Salamat at ingat.
Thank you, Zenei. Thank you,
Thank
Fatima.
you.
And more power to both of you.